Pressure ulcers are a significant problem for wheelchair users, with incidence from 60 to 85% for certain subpopulations. Pressure ulcers reduce productivity, limit independence, and harm quality of life. They can also cost as much as $50,000 to treat, and far more when a hospital stay is required. To prevent pressure ulcers, clinical recommendations are to perform weight shifts every 15 to 30 minutes, but studies show that wheelchair users rarely follow this advice. To help their clients remember to do pressure reliefs, clinicians often recommend standalone or smartphone-based timers, but these must be manually reset and do not offer any feedback as to whether the pressure relief has been adequate to allow the tissues time to recover. The manual wheelchair virtual seating coach consists of sensors to measure weight distribution on the seat, an algorithm to interpret those measurements, and a smartphone app to alert users when it is time to do a pressure relief. Importantly, these reminders are given only when the user has not recently done an adequate pressure relief, greatly reducing their intrusiveness relative to timers. The app can also store the data, allowing users and/or their clinicians to track progress over time, or the data from many users can be pooled for research purposes. Whether installed on wheelchairs in an acute rehab environment for training purposes, or on an individual's own chair for long-term use, the manual wheelchair virtual seating coach should reduce the likelihood of developing pressure ulcers, lessening medical costs for insurers and users, and improving quality of life. Over 250,000 veterans use mobility-assistive equipment, such as wheelchairs and scooters. One 3-year study of veterans with spinal cord injuries found that 39% of them developed a pressure ulcer, and that 57% of those pressure ulcers were stage 4, the most serious. For veterans with spinal cord injuries alone, it has been estimated that the VA spends $100 million a year on treating pressure ulcers. When considering all veterans who use wheelchairs, the direct costs of treatment are far higher. That does not even consider the indirect costs and lost productivity, and the real human costs and quality of life.